Body mass index, or BMI, is a measure of body size. It combines a person's weight with their height. The results of a BMI measurement can give an idea about whether a person has the correct weight for their height. BMI is a screening tool that can indicate whether a person is underweight or if they have a healthy weight, excess weight, or obesity. If a person's BMI is outside of the healthy range, their health risks may increase significantly. Carrying too much weight can lead to a variety of health conditions, such as type 2 diabetes, high blood pressure, and cardiovascular problems. A weight that is too low can increase the risk of malnutrition, osteoporosis, and anemia. The doctor will make suitable recommendations. BMI does not measure body fat directly, and it does not account for age, sex, ethnicity, or muscle mass in adults. However, it uses standard weight status categories that can help doctors to track weight status across populations and identify potential issues in individuals. BMI in adults. BMI calculator shows healthy weight. A BMI chart or calculator can show a person if they have a healthy weight. Calculating BMI involves measuring a person's height and body weight. Metric. To calculate BMI in metric units, use the following method: BMI equals kilogram per square meter. So, to calculate an adult's BMI, divide their weight in kilograms kilogram by the square of their height in meters m2. Since most people measure height in centimeters cm, divide height in cm by 100 to get height in meters. Imperial. When using imperial units, the formula is BMI equals lbs x 703 in 2. In other words, multiply a person's weight in pounds lbs by 703. Then divide by their height in inches squared in 2. To avoid using the math, a person can use a calculator or a chart to find their BMI. BMI calculator. Enter height or weight in either imperial or metric measurements to find your BMI. 1. Metric BMI calculator. Height in meters e.g. 183, weight in kilogram e.g. 63. 2. Imperial BMI calculator. Height. Feet, inches, weight. Stones, pounds. BMI charts. People can also work out their BMI using a chart. Click here to see a chart provided by the National Heart, Lung, and Blood Institute (NHLBI). Locate your height in inches on the side of the chart, then look across to find your body weight in pounds. Scan to the top to see if the result corresponds to a normal weight, overweight, or obesity. Understanding the results. The following table shows standard weight status categories associated with BMI ranges for adults. BMI weight status: below 18.5, underweight 18.5 to 24.9, healthy 25.0 to 29.9, overweight 30.0 and above, obese. BMI of less than 18.5. A BMI of less than 18.5 indicates that you are underweight, so you may need to put on some weight. You are recommended to ask your doctor or a dietitian for advice. BMI of 18.5 to 24.9. A BMI of 18.5 to 24.9 indicates that you are at a healthy weight for your height. By maintaining a healthy weight, you lower your risk of developing serious health problems. BMI of 25 to 29.9. A BMI of 25 to 29.9 indicates that you are slightly overweight. You may be advised to lose some weight for health reasons. You are recommended to talk to your doctor or a dietitian for advice. BMI of over 30. A BMI of over 30 indicates that you are heavily overweight. Your health may be at risk if you do not lose weight. You are recommended to talk to your doctor or a dietitian for advice. BMI in children and teens. In adults, BMI values are not linked to age and are the same for both sexes. However, measuring BMI in children and teens is slightly different. Girls and boys develop at different rates and have different amounts of body fat at different ages. For this reason, BMI measurements during childhood and adolescence take age and sex into consideration. Doctors and other health professionals do not categorize children by healthy weight ranges because they change with each month of age. Male and female body types change at different rates. They change as the child grows taller. Doctors calculate BMI for children and teens in the same way as they do for adults, by measuring height and weight. Then they locate the BMI number and person's age on a sex-specific BMI for age chart. This will indicate whether the child is within a healthy range. Calculator and charts for child and teen BMI. The Centers for Disease Control and Prevention (CDC) have produced a calculator that provides BMI and the corresponding BMI for age percentile on a CDC growth chart for children and teens. First, click here for the calculator. Next, use the charts to see if a child's weight is suitable for their age. Click here for the charts. Girls aged 2 to 20 years, boys aged 2 to 20 years. What do the results mean? The following categories explain the meaning of the results. Weight status category: percentile range, underweight below the 5th percentile, healthy weight 5th percentile to less than the 85th percentile, overweight 85th to less than the 95th percentile, obesity equal to or greater than the 95th percentile. How doctors use BMI. BMI is not accurate enough to use as a diagnostic tool, but it can screen for potential weight problems in adults and children. If someone has a high or low BMI, a doctor or other healthcare professional might then consider other factors, such as skin fold thickness measurements, which indicate how much fat is in the body in adults and children. Evaluations of diet and physical activity. Discuss any family history of cardiovascular disease and other health problems. Recommend other appropriate health screenings. The doctor or healthcare professional can then make diet and exercise recommendations based on these results. If you like more video, just share and subscribe on this channel. Thank you.